When recovering from an injury or a medical condition, there is no better place to do so than your own home. Here to tell us what Home Rehab Express can do for you or maybe a loved one is Joanne Ellis with Home Rehab Express. And joining her this morning is Dr. Cliff Burmeister with Foot and Ankle Management Group. Good morning to both of you. Glad to have you back.
Thank you, Carly.
Joanne, let's talk. Let's first start with you. Remind people what Home Express can do for them and what home health care is all about.
Sure. Home Rehab Express is a home health company, and we provide physical therapy and nursing services to patients in their own home. So patients who are unable to get to the doctors more often than they are unable to get to the doctors less often than they should, we're able to provide those services at home through insurance.
Yeah, and of course you work with a lot of different doctors here in Southwest Florida.
Yes.
Dr. Burmeister, one of them. And we were just talking about the benefits of home rehab. You know, they really can go a long way. But this morning, let's talk about heel pain. And is this something that comes up a lot in your office that you see a lot of?
Unfortunately, it does.
Yeah.
It's one of the more common things that we see.
So what causes heel pain?
A large majority of the time, it's something called plantar fasciitis.
Oh, yes.
Yeah, that's an inflammation of the long ligament on the bottom of your foot.
Okay,
Now,
that's all it is inflammation?
It is. So what happens is patient will stay, especially in the mornings or when they're sitting and they go to a standing position, that they get an aching, throbbing pain in the arch. And a lot of times that's that ligament right where it originates from the calcaneus. A lot of times it starts pulling and you get inflammation and ultimately a lot of pain.
Okay. Does it eventually happen over time? What causes that?
A lot of times it'll come on suddenly.
Okay.
But as it becomes a more chronic issue, a lot of times that's when it becomes a lot more difficult to treat.
Do you have to have surgery to treat it?
You
How do
don't have to have surgery.
All right.
So 90% of the time, plantar fasciitis is conservatively treated with, again, rest, ice, and I always tell people, take a frozen water bottle and dump a little of the water out and freeze it, and then you can kind of roll your foot out, and it's kind of like a massage.
That's a great tip. I had not heard of that. I know a lot of people suffering from this, so yeah, I'm going to spread the news on that.
A lot of times, stretching is very important after we calm down the inflammation.
Okay.
And ultimately, arch supports. Because everybody...
So shoes, make sure you're in the right shoes.
Everybody comes down in their cutesy sandals for South Florida. So it does become an issue.
Yeah.
And sometimes it's just your biomechanics, the way the good Lord made your foot.
Yeah.
So supporting the arch is very important as well.
Well, doctor, thank you so much for being here this morning. I'm gonna take that ice tip, the frozen water bottle. That's a good one. If somebody has more questions about his office or what you guys are doing, what would you have them do?
I would have a patient ask their doctor to refer them to Home Rehab Express for home health care, and they can visit our website at homerehabexpress.com.
Easy enough. Thank you both so much. We look forward to having you back.